All right, Betsy, if you can make George back to the host, and George, if you can make Betsy back to co-host.
There we go. It's done. All right. And we are live.
Betsy, do you want to go ahead and make me the, oh, okay, gotcha.
Yeah.
Good morning, everyone.
Good morning.
Good morning.
We have somebody who joined by phone. If you could unmute yourself and identify yourself, and we'll change your name so it shows up on the screen.
Hi, this is Kimberly King from DBHDS.
Great. Thank you, Ms. King.
Thank you.
Well, let me know if is it Kimberly with an EY or a Y?
Just a Y.
Okay, great. Thank you.
You're welcome.
Good morning, everybody. My name is George Worthington. I'm the Dementia Services Coordinator with the Department for Aging and Rehabilitative Services. Welcome to the quarterly meeting, the annual meeting of the Virginia Public Guardian and Conservator Advisory Board. I have 10 o'clock, so we'll go ahead and get started. I'm going to turn the meeting over to our chair, Rose Palmer.
Good morning, everyone. Before we start the meeting, George will provide some housekeeping regarding the electronic meeting. And George, if you'll take care of that for us, please.
Sure. Thank you, Rose. Most people are probably fairly familiar with Zoom at this point, but I'll just let you know a few menu items. I'll repeat that we are live streaming this meeting to YouTube in order for members of the public to be able to view it. So that will continue until the end of the meeting. We're also recording the meeting, and we'll post that recording for anybody to view at a later date. If you, just to navigate around the Zoom screen, you have a menu bar either at the top or the bottom. And you'll see a microphone with a mute. We'd ask you to please mute yourself unless you're talking. If you are muted, you can press and hold the space bar to temporarily unmute yourself. So while you're speaking, hold the space bar down. Please keep your video on so we can see you if you have a video. That would be great. You can use the chat function to let us know of any technical issues. You can speak with everybody or with anybody privately. And you can use the chat to ask or answer questions of staff. So we do have staff who are monitoring the chat in case there are any technical issues. I'll just let you know as well that if for some reason the live stream breaks down or falls out for some reason, we will have to pause the meeting until that live stream is reconnected. And finally, you have reactions. You can use a thumbs up to show agreement, although we will be taking roll call votes through this meeting since it is an electronic meeting. You can also use the clap function to raise your hand if you'd like to speak. And then on the right-hand area of your screen, you should have some view options. You should be able to see thumbnails of everybody who's in the meeting. You can change those to show just one or a gallery by moving your mouse or cursor to the area at the top of those thumbnails. Okay, and I'm just going to put the agenda up so everybody can see that. And then, Rose, I'll turn it back to you.
We have a quorum, so we are ready to proceed with business. George will do a roll call of members, staff, and guests to introduce themselves. Please unmute yourself and state your name, your organization, or affiliation for the full board when your name is called. Thank you.
Thanks. Would you like to start, Rose?
Certainly. I'm Rose Palmer. I am the chair of this committee. Of this board. And I am a member at large of the board. I'm an attorney in the Mechanicsville area, and I handle elder law and family law cases.
Thank you. Veronica Williams?
Hello, my name is Veronica Williams. I am an elder law attorney. I'm down in the Hampton, Newport News area. I am the representative to the board from the Commonwealth Council on Aging.
Thank you. Judge Almond? Might come back to you, Judge Almond. Or you're muted.
Can you hear me? Can you hear me?
Yes.
This is Jim Allman. I'm a retired circuit court judge from Arlington and serve as a member of the board and chaired the nominating committee.
Great, thank you. Kathy Harkey?
Good morning. My name is Kathy Harkey. I'm Executive Director of NAMI Virginia, which is the National Alliance on Mental Illness. And I'm new to the board. Welcome to all of you. I'm glad to be with you.
Thank you. Angela Harville?
I think we have Kimberly King in place of Ann today.
So I'm showing Angela on the call as well. So I think
yes, I was trying to get myself off mute. Good morning.
My name is Angela Harvell, and I'm the Deputy Commissioner for Facility Services at the Department of Behavioral Health and Developmental Services. So I work with all 12 of the state behavioral health hospitals, as well as Hiram Davis Medical Center and Southeastern Virginia Training Center. I am new to the board and looking forward to learning all about what you all do and how we can continue to support. And as someone mentioned, Kimberly King is also a part of our team, and she and I will be tag teaming this endeavor and working together moving forward.
Great, thank you. George McAndrews?
I'm George McAndrews. I'm an assistant city attorney in Alexandria, and I'm technically a citizen member of this board, but I have worked for years with guardians that we get appointed for as city clients.
Great, thank you. Angie Phelan?
Yes, I'm Angie Phelan. I work at Senior Connections, the Capital Area Agency on Aging, and I am representing the area agencies on aging across the state.
Thank you. Latoya Roxburgh?
Hi, my name is Latoya Roxburgh. I'm a licensed clinical social worker, and I have a private practice, L. Smith and Associates, in Northern Richmond.
Thank you. Okay, so we'll move to DAR staff. Marcia Dubois? Marcia, you're muted if you're speaking. Might come back to Marcia. Charlotte Arbogast?
Hi, can you hear me?
Yes.
I'm Charlotte Arbogast. I'm in the policy division at the department and a presenter here today, and also staff to the Council on Aging.
Thank you. Patty Meir?
Hi, I'm Patty Meir. I'm the coordinator of the Public Guardian Program, and I work at DARS. George, I didn't know my colleague Betty Fines is also on the line.
Thank you. Marcia?
Good morning. I'm Marcia Dubois. I'm the Deputy Commissioner for the Division for Community Living for the Department for Aging and Rehabilitative Services.
Thank you. Betty Vaughn?
Morning, Betty Vines, Program Specialist for the Public Guardian Program here at DARS.
Thank you. And Emily Hoyt.
Hi, everyone. I'm Emily Hoyt, and I am an intern with DARS for the third summer now.
Great, thank you. We have one other person who who's not identified. You're showing up as FRO 70074. Could you unmute yourself and say hello and identify yourself, please?
Hi, George.
Yes. Oh, it's Kathy Miller.
Hey, everybody. This is Kathy Miller. I'm the Director of Aging Programs and Services at DARS. And the Public Guardianship Program is one of the programs that I oversee.
Great, thank you, Kathy. I'm going to turn it back to you, Rose.
Okay, so there are some changes to membership, as you heard as we were going through the introductions. We were going to address those at the end, but if there's no objection, I'd like to move forward with that as the first item of business. Any objections? I assume not. Two of our members are finishing their terms with the advisory board. Paul Izzo, who represented the Virginia Bar Association. I'd like to thank Paul for his membership and his work on the board, as well as his service as secretary. We appreciated his knowledge and wisdom. We have a new representative from the Bar Association coming on board, but that person has not been appointed yet. Robert Reed, who represented the commissioners lend of the Department for Behavioral Health and Developmental Services, or DBHDS, resigned from the advisory board earlier this year and will be replaced by Angela Harville. And thank you, Angela, for joining us today. We look forward to your service and your wisdom at coming on the board. Robert Reed, we'd like to thank you for your service as well, and appreciated your input while you were with us. Finally, I'd like to welcome Kathy Harkey, the Executive Director of NAMI. Kathy has been with NAMI since 2006 and is passionate about creating stigma-free communities, NAMI programs, and advocacy for solutions and create positive change. We are thrilled to have you, Kathy, and I'm sure your wisdom will be quite helpful as we move forward. Has everyone had an opportunity to review the March 5, 2020 minutes? They're up on the screen now if you want to take a moment and breeze through them, and then we will be moving for the minutes to be adopted.
It's a little fast to read them, but hopefully everybody would have received a copy of those beforehand.
Are there any changes to the minutes? If yes, please identify yourself. I'm presuming there are no changes to the minutes, and therefore the minutes are adopted as. We'll move on to public comment. As I understand it, there's no public comment received, so we can move on to the next item on the agenda, which is the nominating committee report. Judge Allman, if you would please be so kind as to give us your report.
All right, thank you very much. The nominations committee met earlier this morning and unanimously endorsed a slate for election and presentation to the full board. We place a nomination, Rose Palmer for a second year as chair, also Veronica Williams, a second year as vice chair, and for secretary, the nominations committee presents LaTroy Roxburgh. And those are the, I would place those nominations on behalf of the nominations committee.
Thank you, Jim. George, would you do us the honor of the roll call vote?
Yeah, Rose, do you want to see if there's any other nominations from the floor before we do the roll call?
I apologize. Yes. Are there any further or additional changes or nominations from the board?
Okay, hearing none, I think we can go ahead with the roll call. I'm going to do this in alphabetical order. Jim Almond,
I vote yes for the.
Thank you. Kathy Harkey,
Yes.
Angela Harvell, Angela Harvell, could you unmute yourself and vote? We'll come back and give you another chance. George McAndrews,
Yes.
Rose Palmer, Rose Palmer, could you unmute yourself and vote?
Yes.
Thank you. Angie Phelan,
Yes.
Latroy Roxburgh,
Yes.
Veronica Williams,
Yes.
Angela Harville, are you there to vote?
Yes.
Thank you. Christy Zed is absent. Tara Ragland is absent. And Monica Caravanish is absent. So I believe that's everybody. And the ayes have it.
Thank everyone for their time this morning in the nomination committee board meeting or committee meeting. And I appreciate Slate. I look forward to serving the board one more year as chair. I would like to move on to the Division for Community Living report. The chair recognizes Marcia DuBois, the Deputy Commissioner for Community Living at DARS.
Good morning, everyone. Can you hear me?
Yes.
Yes.
Okay. Well, certainly a lot has happened in the world since our last meeting, but I wanted to start off this morning by really recognizing the heroic work of our 25 area agencies on aging during the COVID-19 pandemic. Since we last met and the pandemic started, each of the area agencies on aging was charged with responding in their local community by needing to close down very quickly their congregate settings, be it senior centers, adult day, and very quickly shift to providing home delivered meals, responding to older adults and in their homes, making sure they were safe, providing alternate types of services to replace face-to-face contacts in certain circumstances with other types of checking via phone, via Zoom, and each of them responded in really resourceful ways, creative ways, in making sure that they maintained contact so that folks haven't been socially isolated and have maintained their nutrition, have maintained their safety throughout this period. And DARS has compiled several reports that have really tried to capture these innovative, creative ways that these area agencies on aging, or AAAs, have been able to continue providing services throughout the pandemic to keep people safe. And since we don't have time now, I'll make sure that those get out to you so that you can really see some of the unique things going on here in Virginia. So those will go out to you. Related to the COVID response, here at DARS, we are the oversight agency that receives funding on behalf of these programs. And so, as you all are probably well aware, there were several stimulus relief packages related to COVID-19. And the first of those was the Families First Coronavirus Response Act. So we first received $5.5 million that went to primarily nutrition, that we were able to get a very fast turnaround and get out to the area agencies on aging, and they in turn were able to get that funding out right away. As you can well imagine, the demand increased right away to provide more home-delivered meals to individuals. Shortly after that, at the end of March, the Coronavirus Aid, Relief, and Economic Security Act, or the CARES Act, which most of you are probably more familiar with, was passed. And that impacted a number of programs, including the area agencies on aging, and it expanded some of the services. So it had more money for nutrition. $5.5 million sounds like a lot, but it's really not. Feeding people costs a lot of money. This expanded the types of services that could be provided to family caregiver services, other types of in-home services. It also included services for the Ombuds program and for our No Wrong Door program as well. So that program received a one-year grant that provided some rapid response assessment efforts, also looking at increasing capacity level and working with collaborating on technology to make sure that people had technology in their homes to be able to work remotely, communicate remotely, to receive services in an alternate way. And so the No Wrong Door program is collaborating with Virginia Assistive Technology System and also working to expand the No Wrong Door initiative through an increase in subawards to certified partner organizations and to increase capacity to respond to the COVID-19 pandemic through information and referral services, options counseling, and more. So that's just a little bit of what we've been doing. Other things that have been happening are that in May, the governor signed the Older Virginians Month proclamation, as well as the Elder Abuse Prevention Month proclamation. Both occurred in May. Other things happening, you all may recall that the Governor's Conference on Aging was scheduled for May 11th and 12th. That was first postponed to occur in the first week in October, and that has now been postponed to next May 17th and 18th. And we're actually feeling very, very good about that change. We've been fortunate that conference is a partnership between the Virginia Association of Area Agencies on Aging and DARS, and we've had really enjoyed strong sponsorship as well as collaboration with all kinds of agencies to have fantastic presentations, and we know that with better planning, we believe that waiting a year, we'll be in a strong position to have a strong data-driven conversation about the pandemic, how we've handled it, and to really showcase innovative ideas that have come out of it. So mark your calendars. It will be in Richmond, May 17th and 18th, 2021. Other things that have happened, also in March, the Older Americans Act was reauthorized and signed by the President on March 25th. There are a lot of really great things in it for caregivers, for aging programs. We will get some specific details to you all, but DARS is waiting to really publish some of those highlights for the public law to be updated at the government publishing office. So our staff will provide more detailed analysis as soon as that's updated on that site. And then finally, wanted to just share some good news. You all may have been aware a couple of years ago, Virginia had 7 Native American tribes who received federal recognition or designation. And of those, though, that's up until recently, none of them had accessed or received any federal funds under Title VI of the Older Americans Act. And that just changed in April. The Chickahominy tribe just received Title VI funding under the Older Americans Act. They received a 3-year grant for that. And so we're very, very excited about this. What that will mean is that they will be coordinating with the area agencies on aging that are in their catchment area. And this is just a really great opportunity for collaboration with their members and with the area agencies on aging that are in their areas. And it's a great opportunity for us to learn from one another. And it strengthens our 4-year plan for aging services. And we believe it's a great opportunity to learn from one another. So that is my update. And I'd be happy to take any questions from anyone.
Marcia, have we heard about any of the other Native American tribes receiving their Title VI funding?
They have not applied. This grant is, the applications are closed for now. None of them will have an opportunity to apply again for another 3 years, unfortunately. We did ask the Administration for Community Living about that. And although all of the tribes heard about the opportunity, they were really reluctant to apply. Some of them may not have had the ability. They have to have a number of their population over 60 in order to be able to apply. But there are other restrictions as well. And so they were a little bit hesitant. So we're hopeful that as they look to the Chickahominy tribe, if they're successful in implementing their application, that they will go for it as well. So we're excited about it, and we think that this opportunity for collaboration will be good for a lot of reasons, and that it may make some of the other tribes look at it at the end of this 3-year period. It's not a whole lot of money for them, but it does provide for some money for them to operate some meals programs and to collaborate with AAAs in their area as well.
Thank you. Mm-hmm. Any other questions? If not, we're going to move on to Charlotte Arbogast's presentation. She's our policy advisor at DARS. And she's going to discuss the FastTrack regulation revision project. Everyone should have received 2 handouts from Charlotte prior to the meeting. Please let us know in the chat box if you did not receive these. Thank you. Charlotte, I turn it over to you.
Great, thank you. It's a pleasure to join the board this morning and provide the presentation. My state computer doesn't have a camera, so you'll just be hearing my voice today, and then George, I think, will be clicking through the slides. As I'm now on the cusp of month 4 of quarantine and telework, I would say that my lack of a camera is probably for the best. George, we go to slide 2. The Public Guardian Program regulations were first enacted in 2009. After the regulations were shifted from the old Virginia Department of the Aging to the new Virginia Department for Aging and Rehabilitative Services in 2012, the regulations were then amended to adopt person-centered language as ordered by the General Assembly legislation, and those changes took effect in 2016. This current project is our agency's attempt to improve the clarity of the chapter and also align it with current law and contract requirements. I believe Rose just referenced the 2 handouts that you should have received a copy of. The first is a crosswalk summary of the changes section by section, and the other is a track changes document with changes integrated as they would appear directly in the chapter. Today, I'm going to review those changes briefly, and then we'll have an opportunity for you to ask questions or provide comments on these suggested changes. And I'll also share with you some next steps in the process. Next slide. The first category of changes I'd like to highlight for you are technical changes. These would be viewed as minor changes and housekeeping changes. In this category, where needed, we have proposed updates to some Code of Virginia references that are no longer accurate. We also tweaked language to make sure it aligned with the Code of Virginia requirements in a few places. An example of this would be the updated definition for guardian. Both of these first two types of changes are related to legislation that has been passed to amend the Code of Virginia, but that had not been followed through with a regulatory change. Lastly, in this category, we also sought to strike unnecessary and duplicative terminology in various places with the hope that it would improve the intent and clarity of the chapter. Next slide. With regard to definitions, the changes proposed include the following: a new definition for face-to-face. This is intended to align with the current contract requirement regarding monthly visits that occur at a face-to-face with the client. We've added a new definition for public guardian program, which is then differentiated from a definition for the public guardian program contractor. The contractor is then defined to reference the legal entity that operates the public guardian program under contract with DARS. Lastly, we have suggested a change to the old defined term or the current defined term of indigency. Indigency was not actually used in the chapter. The new term indigent is used, and it's replacing indigency in the definition. And it is designed to encompass the criteria found in sections 51.5-149, 64.2-2010, and 19.2-159B of the Code of Virginia. Next slide. With regard to changes to the requirements around program structure and operations, we are suggesting the following changes. We'd like to strike the uses of local program and regional program as they're used in the chapter. As this public guardian program at the statewide level has evolved, the terms and the requirements have become equivalent for both, and so the distinction is not needed. We also like to restructure the public guardian program staffing and volunteer requirements to improve the logic and flow. For this bullet specifically, I'm mainly referring to where you see that items have been moved around. This is so that they'll read better. We'll discuss some other changes related to staffing and volunteer requirements a little bit later in the presentation. We've also added here the requirement for the face-to-face meeting with the client once per month. We added the definition for face-to-face in the first section, and now we've added the requirement. This is a best practice and a long-standing contract requirement with the program, and I believe, based on previous meetings I've attended, it's one of the things that distinguishes Virginia's public guardian program from some other states. Lastly, we are seeking to clarify the requirement for programs to coordinate on clients receiving case management services through DBHDS. The current requirement phrasing is unclear, and it referenced the client's court order, which generally does not discuss specific planning goals in that level of specificity. So the new phrasing maintains that requirement for coordination, but just clarifies how it occurs. Next slide. For multidisciplinary panels, we're suggesting first restructuring the MDP requirements for improved logic and flow. Again, like the bullet on a few slides ago, this bullet I'm specifically referring to just moving items around so that they read better. With regard to changes to the MDP requirements, We are suggesting removing a current requirement for representatives on the MDP from each jurisdiction when the program is a regional one. As I've mentioned, there's not really a clear distinction between regional and local program anymore. And so this requirement is overly burdensome to some programs and doesn't necessarily add specific value to the MDP. It's more important to have a variety of individuals, and those are currently spelled out in the MDP requirements and in the chapter. We are also seeking to update the referral screening considerations so that the current requirements reflect our agency's expectations and also current panel practices. Clarified here is the intent for programs to review to ensure that they can adequately serve the potential client before accepting them. Lastly, we suggest moving the requirement that MDPs consider if a limited guardianship or conservatorship is appropriate. So we're just moving it. But then also in such cases, we have added specific instructions for how to make recommendations to that effect. Again, this reflects a best practice and what's generally expected of programs when they determine a limited guardian or conservator would be more appropriate. Next slide. For volunteers, we would like to add to the regulation that the volunteers are required to report suspected abuse, neglect, and exploitation. Staff already have this requirement, and this was likely an omission in the previous regulatory drafting, and adding volunteers is in keeping with best practices and ethical obligations. Next slide. In the category of changes that focus on new hires, training, and orientation, we have suggested first restructuring these requirements for new staff hires, and then subsequent to that, training and orientation for staff and volunteers. Again, this bullet is mainly referring to moving things around. At some points in the current chapter, it switches between hiring and training and orientation, and so this kind of buckets them. And then also they appear in the chapter chronologically and how they would take place. Then further, we would like to clarify the requirements for staff criminal record checks and drug testing. This bullet is specifically dealing with staff and what their requirements are, and hopefully clarifies that phrasing. We would also like to remove the Virginia specific requirement for a diploma or GED from an accredited program for a staff qualification. The current chapter does say that it has to be a Virginia diploma or GED, and a diploma or a GED from an outside of Virginia should be acceptable in these scenarios. We would also like to remove the requirement for knowledge and coursework on guardianship prior to hire for staff. For non-program director staff, this is best covered upon hire and during orientation and training, and it's not always realistic to expect all new staff would possess that level of knowledge on guardianship before they're hired. It would be part of their onboarding process. We have suggested adding a new requirement that program directors have a bachelor's degree. This is an area that we would like your feedback in particular. And we have added a new requirement that volunteers receive a drug screening. Staff are instructed to. This would add to volunteers. It's a new requirement and another area we would like your feedback in particular. Next slide. This slide deals with client records. I think Patty has discussed with you some of the confusing requirements about client records in the past, and we are hoping to clean these requirements up and make them clear to everyone, to our staff, the providers, you as the board, and the public. So among these changes are clarifying that the client's uniform assessment instrument, or UAI, or other instrument should be a current version. Clarifying that the care plan required should be the Guardian Program Care Plan, and that it also should be current. This one is particularly consistent with the intent of Section 51.5, 150, and then subdivision B6 of the Code of Virginia. We would like to clarify that the values history should be current, and that the Guardian report, and if applicable, the Conservator report in the client record should be the most recent one filed. With regard to client records, this is another area where we would like your feedback in particular. Next slide. This last category of changes deals with our agency's evaluation and oversight responsibilities. These changes are mainly housekeeping as well. We have restructured but not changed the requirements for the department for evaluating and monitoring programs, and restructured but not changed the requirements for public guardian programs to maintain compliance and provide reports to the department. Next slide. For some of you, the term fast track might not be something you're familiar with. So I'm going to kind of review that a little bit right now. In Virginia, the Administrative Process Act allows agencies to initiate regulatory changes in 3 main ways. Outside of the first way, which is the standard rulemaking process, there are also 2 other methods that can provide a shorter review of potential regulations. One of these methods allows for changes that are a direct result of federal or state law changes. Those are exempt changes. And the other, the one we're discussing today that we're interested in, is called a fast track process. The fast track rulemaking process is designed to be for rules that are expected to be non-controversial. In this case, the agency would publish the proposed rules with a pre-planned effective date, and then a 30-day public comment period opens up. If during the public comment period, any of the following individuals listed here on the slide raise objections to the fast track process, the rulemaking is switched over to the standard process. In this scenario, the initial publication of the fast track regulation then becomes the agency's notice of intended regulatory action in the standard rulemaking process. However, if no objections are registered as described above, the fast track regulation would become effective 15 days after the close of the comment period, unless the agency withdraws the regulation or requests a later effective date. Next slide. The main benefit of a fast track action is the ability to move the regulation changes through at a quicker pace. A standard rulemaking project can take upwards of 3 to 4 years, and I've seen it in some cases reach 6 years to complete when you consider the stage of the notice of the intended regulatory action, the proposed rule stage, and then the final rule stage. A fast track goes through fewer steps, meaning the agency publishes the regulatory changes for one comment period, and then an effective date can be determined. Essentially, without the layers of the standard rulemaking process, a fast track can mean changes can be implemented faster. Now, I should pause here to say the following. Once the agency develops a standard or a fast track regulatory action, it still has to go through several other reviewing entities before it is published and open for public comment. After DARS has a package ready, it's submitted for what is called an executive branch review. The executive branch review includes reviews by staff at the following: the Office of the Attorney General, the Department of Planning and Budget, the Secretary of Health and Human Resources, and the Governor's Office. Once, or I should say if, it is approved by the governor, then the changes can be submitted for publication in the Virginia Register and a subsequent comment period and a planned effective date. I share this with you because we have not at this point initiated or started the executive branch review phase. and this can take time in and of itself. Except for the Department of Planning and Budget, the other entities I mentioned are not required to review the regulation within a certain deadline, and the length of that review time for each entity can vary widely. Last slide, or next slide. At this time, I would like to open the floor for any questions or comments you have for us. And then George, while we take any questions or comments, I'll ask you to switch to the next slide, which is the final slide. And that has my contact information in case you would like to write it down and reach out later or after the meeting for additional comments or questions. George and Rose, do you want to see if there are any questions or comments?
At this time, are there any comments or questions in regards to anything that Charlotte brought up as far as the fast track changes?
And I'll just highlight that there were 3 areas in particular that Charlotte would be interested in hearing feedback on, and those were whether a bachelor's degree should be required for staff, program staff, whether volunteers should be required to undergo drug screening as staff do, and also on the client records.
Charlotte, I would be surprised that the volunteers were not already being drug screened, so I'm definitely in favor that that should be part of the regulation. I like the way the new client records section reads. As for the bachelor's degree for the directors, I'm up in arms a little bit here. I don't know what to think, because in talking to other agencies or around the country, they who have public guardians, many of them, some of them have no regulation for anything other than a high school diploma. I personally think there needs to be some training, if nothing else, but I don't have an actual objection to the bachelor's.
This is Charlotte. I failed to mention too in my presentation, we're also having, I think it was in the email you received though, we're also doing the same presentation directly with the providers, and we'll be soliciting their feedback. And our hope is that we can, between the board and the providers, achieve some consensus on this package, so that when it does go forward, we don't register controversy on the package or comments that would then kick it back to the standard rulemaking process. So that's kind of where we're thinking too. I should have also added that.
Are there any other comments or questions or concerns?
I just had a question regarding the bachelor's requirement. Have there been any problems perceived with people who don't have a bachelor's, or are there skills that a bachelor's degree confers that we feel people who don't have it are lacking? I'm a little curious as to what the reason is, other than simply they're smarter people.
George, this is Patty. I would just say that we've had in my time with the program, we've had a number of programs that have needed to hire a program director, and that has been their baseline. They have always included that as standards that they've set. And so it just seemed to be a good consensus builder. I think one way, I don't know, maybe we drop it entirely, or we consider whether DARS could give a waiver based on experience. But really it got full when we folded this in, it was because that's what programs were doing.
I don't have any, just would hate to see qualified people who have just in the trenches experience foreclosed. So if you had maybe a waiver, that might not be a bad idea.
Thank you for that comment.
Are there any others? If not, we're going to move on to the public guardianship program update. I do want to thank Charlotte for her program and her presentation. We appreciate all your hard work, Charlotte. Thank you.
Thank you.
The chair now recognizes Patty Meir, the public guardian coordinator.
Hi, everyone. I want to begin by assuring you that during the COVID crisis, our program has been hard at work. Our guardian reps have been seeing people, not seeing people, but interacting with people. And I'll explain more about that, but they are doing just great work given the limitations they have, and they have not lost touch with their clients. So let me begin by assuring you of that. I'm just going to give you a quick rundown of our numbers. I won't go into quite so much detail because our meeting time is short. But as of March 3rd, we're doing a great job. They're doing a great job keeping slots full. As of March 31st, you recall we have 1,049 slots. On March 31st, we had 972 active clients, 67 outstanding offers. So these were people who had been accepted into the program but needed to get to court, and only 10 available slots across the whole state. 8 of those were for unrestricted slots. 1 was a DBHDS ID slot, and 1 was a DBHDS MH slot. Currently, there are 106 people on the DBHDS ID wait list. That is a growing number, although of course in this quarter we didn't see it grow quite at the rate it has been growing. Let's see. For the first 3 quarters of the year, we have gotten court orders entered for 86 people. So that's 86 newcomers with court orders into the program so far in this fiscal year, using March 31st as the cutoff. During the 3rd quarter, we made 6 new assignments in DBHDS slots. For the first 3 quarters of the year, we've had 57 deaths. So those are the numbers. And if you want me to break it down by different funding categories, I can, but I'll just give you the highlights unless you ask. Now, as far as how we've responded to COVID, we suspended face-to-face visits in early March before the governor's stay-at-home order. We took that position in response to the position taken by long-term care facilities that began shutting their doors. The way this really happened was long-term care facilities shut their doors to outsiders except necessary medical personnel in advance of the governor's order in response to guidance from their trade organizations, which I think was probably really coming from CMS. They were beginning to hear noise and rumblings. But at any rate, we were seeing it before the governor's order, and we did suspend that. And what we ask is that our programs honor the direction they received from the residential providers. We did that honestly with a little bit of trepidation. You know, we all get concerned about how long-term care facilities do on a good day, and this was certainly not a good day within the facilities. But for everybody's safety, we decided that that was the best way to go. We have had a couple of facilities that pushed the issue because they were particularly concerned about rumblings about quality of care within a particular facility. And they were admitted with masks and PPE and were able to address the problem. But that is the unusual situation. All of the programs report that they are in touch with either clients through video chatting or telephone calls, or with care providers in facilities for those people who are too ill or unable to participate in electronic communication, at least twice a month. And most clients or their caregiver are receiving a contact weekly. So life goes on. And now we're beginning to focus on how we will begin visitation again when the facilities open up. You know, there are probably about 5 people who are not living within a congregate setting. So almost all of our clients are in congregate settings. And we were fortunate. We were not beneficiaries of any of all those federal dollars that Marcia was talking about. We are entirely state funded, but we were able to identify a small pot of money that we could use to buy PPE. So with DARS support, DARS has found a way to purchase PPE that once visitation begins, we will be able to provide that to all 13 of our programs, so that they can go in and mask up and wear face shields. Our PPE unit is face shields, gloves, mask, which we were able to get hold of, KN95s, and a few lab coats for people who are particularly ill. We're developing a policy. Of course, we will not be asking our guardians to visit people who are actively sick with COVID. Or evidencing symptoms. But this is intended to figure out how they can see people who are pre-symptomatic or asymptomatic. And we are concerned both with the potential for us spreading the infection from facility to facility as we visit several clients in a day. We are also concerned about the safety of our guardianship reps, because of course, we are subject to OSHA regulations. Our programs are subject to OSHA regulations, which say you have to protect your employees from foreseeable hazards. You know, of course, they're human beings. They have the same range of vulnerability that all of us do. We have some that have chronic underlying conditions, and it's not safe for them to go. So I'm just really excited that we've been able to provide some PPE. We've just gotten that ordered this week, and I can tell you the programs are exceedingly grateful. They don't have a whole lot of extra money with which to go out and buy the necessary PPE. So I'm glad we've been at least able to give them enough for 6 visits with each client. And I think that'll get us going again when we can get back in the facilities. In the things I've been hearing from CMS is that facilities will probably begin to open up again when states are in or localities are in phase 3. And so of course, Virginia isn't there yet, but I think it's coming quickly. The nursing home standards are the standards that seem to be getting adopted down the chain. CMS makes decisions about nursing homes, and then it follows for ALFs, and DBHDS has to figure out how to handle group homes. But so far, you know, once the nursing homes have figured it out, it all seems to fall in line and be pretty consistent. So as far as our clients and their experience with COVID, we have had only 17 active clients come down with COVID infections. We've had 1 death. 5 of our clients who had positive diagnoses have recovered, and the status of the remainder, you know, they're still sick and it's up in the air, and we're hopeful that they will be fine. So that is basically my report. If you have any questions, I'll be happy to try to answer them. There is one last thing I would like to say, though, and that is I'd like to acknowledge Deb Smith, who isn't with us today. Deb was the representative to this board for the commissioner of DBHDS. But in addition, I worked very, very closely with Deb on the Public Guardian program. She was our liaison with DBHDS and really was a huge help to us as we expanded the program. You know, the 2016 expansion mostly concerned getting more DBHDS ID clients into the program. It was complicated. It involved working with lots of CSBs, lots of referrals, trying to move things quickly, lots of support coordinators. And Deb was just always a tremendous help and ally to this program and supporter of this program in that capacity. And we certainly look forward to getting to know more people at DBHDS who will help us going into the future. But I couldn't let Deb go without saying how much she had meant to this program. So if there's any questions for me. All right.
Thank you, Patty. We really appreciate your time. And I second your comments on Deb. I always appreciated her manner and upbeat personality as well. So we are going to miss her. Is there any new business at this time? Is there any old business at this time? We have scheduled future meetings for September 3, 2020 and November 19, 2020 for our next 2 quarterly meetings. And please mark those on your calendar. And we look forward to hopefully seeing everybody in person again. Are there any other questions, concerns that we need to discuss before we adjourn?
Can you repeat the upcoming meeting dates? This is Kathy.
Hi, Kathy. September 3, 2020 and November 19, 2020.
Thank you.
If there are no other questions or comments or concerns to be discussed, then I'd like to move this meeting for adjournment.
I move we adjourn.
Second.
All in favor?
Aye.
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 George, is there anything else we need to do before we close?
Nope, you may adjourn the meeting, Rose. Thank you.
Thank you all for coming today, and we appreciate your participation.
Thanks, Rose.
Thank you.
Goodbye.
Thank you, Rose.
Thank you.